Okay, hello everyone. Welcome to Happy Hour for ABA, or Happy Hour for whatever. If you're doing Happy Hour, it is 1 minute to 5, so I will not have a sip yet. It's not officially Happy Hour. I just got on here a moment early. Uh, let's see, what are we talking about today? There is so much stuff. So I set aside a couple of posts that I thought were interesting to talk about, although we can talk about more stuff. But the main one that I've been following in the group that like really blew up today is about interventions to reduce sensitivity slash criticism to feedback. I should actually tag the person so that she knows we're in here. Lucy. Well, let me find her. Maybe this isn't the best way to do it. I'll wait until after. Anyway. You would think there'd be an easy way to link to it, but there's not. Okay, so the question was any interventions to reduce sensitivity to criticism and feedback, which is reasonable, right? Okay, the top comment is if they don't have thick enough skin for feedback, they don't have thick enough skin to take a child screaming or hitting them. I think this was misunderstood to be staff. The person posting was asking about a child that had issue with feedback. So there's been posts since I looked at it earlier today. And basically, what I would say for sensitivity to feedback and what I've done for that. And I also did an hour-long podcast on narcissistic personality disorder, and it's a similar intervention because really, if you think of narcissism and narcissistic personality disorder, uh, the main thing is that they are very hypersensitive to criticism or any kind of corrective feedback, and that's when they tend to become like really aggressive or dangerous or whatever. So basically, what I would do is do a sensitization program where you would give them a tiny bit of criticism. So it could be like there's a piece of fuzz on your shirt, like the same as you would do with any exposure therapy, basically. So let me take a sip since it's 5:01. All right. So I would do exposure therapy to criticism. The way I've done it is, oh, you have a little lint on your shirt. If they're very like uptight about their appearance, like different people care about different things, so you have to do criticism that's going to bother them a little, but it should be like a really mild criticism so that they're going to be bothered, but they can work through it and see that they're fine. And then you can reinforce that, is the best way that I've seen to go about it. And it's almost like when you teach little kids, if they fall and then you tell them like no big deal, like I think we've all done that when we're working with kids, is teach them no big deal, like it's fine, you made a mistake, we'll do it again, no problem. It's the same kind of thing, but these are adults who never got the no big deal lesson. So they think everything is a very big deal criticism wise. And that made sense to me because I asked the poster what the function was. A lot of people have replied to this, so let me find where I asked. I asked the age and the function, and she said they were a teenager, which makes sense because, you may or may not know this, all teenagers and toddlers developmentally it is appropriate for them to be world-class narcissists. It is not a personality disorder when you're a teenager. It is how you're supposed to be, and you eventually grow out of it. But this sounds exactly right, that this is a teenager who's just being very narcissistic and thinking that the world revolves around them and that everyone's watching their every move. And if I screw up, everyone's going to know and they're going to hate me, right? This is like a very teenage thing. Or if you're an adult with narcissistic personality disorder, it becomes a thing as an adult, but it's not great. The poster also wrote back that it's usually attention and escape, and that makes sense because narcissists are people that need a lot of reassurance, right? That they're awesome and they're pretty and interesting and smart and all of that stuff. You have to have a lot of attention to feed you. That's your food, right? If you're narcissistic and you don't have people around, you're in a huge amount of trouble. So attention makes total sense. Escape makes total sense because criticism, if you are very sensitive, like a narcissist would be to criticism, feels horrible. It's like setting your own hair on fire. Like it's a type of pain. So, of course, they're going to escape anything that makes them feel like they're being criticized. So, the best thing that I've done, and it depends on the age, but like a teenage version is just like, it's cool. I'm fine. Instead of like, no big deal. We're not going to do that because they're not toddlers, right? But it really helps them kind of like learn which things they can safely ignore. And then, like, if you can work in that, if you're kind of cool and able to go with the flow, people generally will like you more, not less. So that's how to make more friends. That kind of helps too. Not always, but sometimes, it's easy to lose perspective, especially when you're feeling attacked. Um, so those are the kinds of things that I've done. Now, I was going through the rest of this thread, and it was a wild ride, I have to say, because this is bcba resources. I'm assuming we're all board certified, either RBTs or bcabas or bcbas. You're supposed to be if you are in the group. That's what's in the rules when you join, right? So now, like, some of the comments that really threw me, it's common for ADHD and autism. It's defined as emotional dysregulation that may manifest as low frustration, like, kind of, but this is very mentalistic. Like, this does not sound like a behavior analyst talking. And it's a lot of explanatory fictions and mentalisms that, like, again, I don't think they're helpful, right? Um, Conceptualize them as anxiety, create a visual with numbers 1 to 10. That's emotional regulation. But again, conceptualize that anxiety is not really behavior analytic. And it's not the same as anxiety. It's not the same as a future fear. It's current pain that's happening in those cases, at least if someone is a narcissist, is how that would kind of work out. I have a CEU on treating things that we call anxiety with ABA using habit reversal and ACT and exposure and graduated therapy and all of that stuff. Like, I'm in mental health counseling, right? Like, I'm not against it. I'm just saying, like, be careful because that is not ABA at all. And I feel like what we do is way more powerful than typical mental health counseling. So, like, let's not lose the power of the things that we do because I think we're awesome, right? So there were other comments teaching a growth mindset from Carol Dweck. Like, Dweck, that's interesting. It's fine. It's useful. Nothing to do with ABA. And also, I have found that most people, when they're very upset, do not receive the information that, well, at least you'll grow from something terrible very well in the moment. Usually it makes them more upset and isn't helpful. So I guess that's something you can kind of like talk about outside. But again, it's not behavior analytic at all. Like, what function does a growth mindset treat? What is a growth mindset? How are you measuring the mindset? How are you observing the mindset? How are you writing a growth mindset into a treatment plan? Like, again, this is like stuff that social workers and mental health counselors do, and we're supposed to be BCBAs. I always go back and forth if I should delete things that are outside our scope, and I tend to leave them up and like reply of like, be careful, this isn't really behavior analysis anymore. But yeah, then there was some more stuff, but it was similar. It was all just very mentalistic. Shout out to Camille. She always has great comments and she is after my own heart. We are very similar in the kinds of things we do in our practice. So definitely go read her comment. She has great information that I think is very helpful. And she brings up ACT too. I love using ACT for stuff like this, especially for like personality disorder sensitivity kind of things. But yeah, there were other issues that I saw in like sub comments that just really threw me because behavior analysts were writing them. And it kind of frightens me for our field a little bit. Like, this is another one, not a recognized diagnosis in the US. There's information, blah, 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 in rejection sensitivity dysphoria, RSD. Like, no one likes being rejected, right? Like, there's no dysphoria to rejection. Rejection feels bad because that's what rejection is. So I don't know why we would pathologize that necessarily. That seems odd. But again, like, why are you bringing it up? You're a behavior analyst. That diagnosis is unhelpful. It's useless. It's a mentalism. We can't measure it. We can't alter it. We can't do anything with it, right? So I'm very into the applied dimension. I want everything to be pragmatic, and you can't be pragmatic or in your scope of practice. Like, you're putting your certification at risk. if you're doing stuff like this, which should bother you. But if it doesn't bother you, what's more bothersome about that is that you're losing the power of what we do as a field. And I think that is just, it's a shame, right? So that's what I have to say about that. I've done it more with adults that have narcissistic personality disorder or they're somewhere in cluster B. And that it's a teenager makes total sense because developmentally, a teenager doesn't have a personality disorder, but they are narcissists. It's not a disorder because it's normal for them developmentally. Okay, what's the next one on here that I was going to talk about? I'll have a sip in the meantime. And for people watching, because there's some of you here, if there's anything you want me to talk about, go and write it in the comment box and I will address it as long as I see it. Okay, so this one's from Alicia Cranston. Looking for out-of-the-box ideas for pre-K students struggling for class nap time routine, using visuals, countdowns, fidget, weighted blankets, calming visual screen, mic and visual. Okay, so she's got a lot of supports in the environment, and that's really good. I like that a lot. You don't have to be that out of the box, or we can get out of the box, but first we have to know the function, right? Or at least like what the contingencies are around nap time. So I would say you have to figure out what the problem is before you can figure out what to do to fix the problem. The ways I would go about figuring out what this problem is with nap time is the number one thing I would investigate is the kid tired at nap time? Because if I'm not tired, then I'm going to be really combative and not wanting to take a nap, right? Then there's the other reasons. Well, we'll stay with not sleeping, right? So like, are they sleeping too late in the morning? Maybe mom can get them up earlier. Are they like falling asleep somewhere in the room? Make sure the teacher forces them to stay awake until it's nap time. See how much sleep they're getting at home. Stuff like that is what I would do for the sleep. See how early they're getting up in the morning. Just work with the parents, see what their sleep schedule is, and that might help you with nap time. The other thing is, are they taking stimulants? And if they are, again, you have to ask their parents, but how would you know, right? And if they're taking Ritalin or something like that, which pre-K would be so early, I cannot imagine it, but there's some like allergy medicine that's a stimulant. Just make sure they're not taking anything that's a medication or drinking like caffeinated soda that would keep them awake. And then I would look at like what happens right before nap time. Like what are they supposed to stop doing before they go sleep? And to sleep or nap, like we adults forget. I love going to sleep. It's my favorite time of day is laying down in bed because like no one can ask me for anything and I think it's so beautiful and I'm very tired. But I've also seen everything. Like I'm not like, oh, I can't step away from the TV. What if I miss? I don't know. I'm like I'm almost 42. Like I've seen all of the things. I'm not like I'm gonna miss out if I step away. Kids in pre-K, everything is brand new and really exciting and really, really awesome. So they don't want to go to sleep. They don't want to miss stuff because they are like engaged in absorbing stuff like a sponge 100% of the time. So even when they're tired, they want to like hold their little eyelids open so that they can go interact with more stuff because literally everything in the world is kind of new and exciting, right? So you want to have the thing that's right before nap time be like the least amount new and exciting as possible because when you think about what sleep is the most boring thing you can ask a child to do. To fall asleep, you have to lay down and basically pretend to sleep by doing nothing. And most kids don't want to do that and find it very, very boring. So I would say if what they're doing right before nap time is like fascinating and engaging, maybe make that earlier in the day or after nap time or contingent on good behavior during nap time even. And make sure there's stuff after nap time to look forward to, but not like the most exciting thing as soon as they wake up, because then they're so excited about the thing after their nap that they may not fall asleep in the first place, if that makes sense. So those are some of the things I would do with nap time. I also might try to get them to, like, if none of the other stuff is ruled out, just like burn some more calories in the morning and get them to be more tired, right? Just like work with your establishing operations. And get some motivating operations going for sleep, which is tiredness, right? Like a deprivation state for sleep. So that's kind of where I would go with that one. Let's see what the next one is. Okay, nobody's written anything, so I'm going to keep going. Open link. Oh, I opened on the wrong page, but that's all right. As if you guys can see what I'm doing, which I really hope you can't. I don't think you can. Okay. Oh, leadership skills. All right. So, does anyone have suggestions for a professional development CEU that apply the practice to effective leadership skills? Yes, I am developing one that me and my partner that I'm working with, who is amazing and wonderful, are aiming to have it be like a workshop, hour and a half kind of thing on the 24th, which is a Thursday evening at like 6 or 7 p.m. And what we're looking at is Seligman's research on positive psychology and applying OBM principles to that to prevent burnout in staff and recognize when your staff are smoldering or on their way to burnout and how to bring them back from the edge, right? So it's not, I mean, you could take it yourself to like see if you're burning out or whatever, but it's really aimed at supervisors and it will be for 1.5 supervision CEUs. So I suggest that once it exists. It doesn't quite yet, but it will very soon, and then I'll post about it a lot in the group once it does. Okay, I have a comment. Unhide. I have a question with a scenario I encountered. I received a referral for a client for ABA services. This client was diagnosed with anxiety and autism and was receiving mental health therapy. After the assessment, I noticed per the client's report, social delays were due to private events, thinking like no one likes her, no one's to be her friend. Typically, I've been taught to say this client does not need ABA and stick with mental health therapy. Do you think in scenarios like this we should attempt ABA? Yes, I think we should attempt ABA in situations like that. I've done it a million times. Absolutely. So I've done that with clients that are typically developing, that have intellectual or developmental disabilities, learning disabilities. If your client is verbal, it makes it easier. I'm assuming she is because you're saying she thinks no one likes her and no one wants to be her friend, which makes me believe that she told you that. If you're still there and that's not the case, please respond and let me know. But there's a lot of stuff you can do with this. And actually, it's pretty similar, not like totally dissimilar, to the kind of thing I was just saying for the person who had a client that was very sensitive to criticism and was kind of like overreacting to it. And I was saying to kind of treat it almost like someone with narcissistic personality disorder, where you do like very gradual exposure therapy to accepting critical feedback and kind of like taking that in. Depending on the client's age, let me double check one more time that she's like at least a middle school or teenager. ACT is really good for stuff like this, especially if she's verbal. Because if you get like in the nitty gritty with RFT, and I get into this in my anxiety CEU thing, but I don't teach you how to do ACT. That's outside of one CE. But there's a way to do just like words or words. So you would say like water not 300 times, like 30 times. And if you say any word enough times, it sounds like nonsense, right? Like fork, 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 fork. You have them do it for a minute on a timer. And after a minute, no word sounds like any kind of word. So if there's like very specific phrases she's thinking about over and over and taking very seriously, it's a cool exercise to just say the words over and over so that it kind of like makes it incredibly obvious to you that words are just words and nothing more or nothing less than that. So that is a really good way to do it. And another thing that I've done with clients that had some delays, if they thought that, and I would facilitate this because if you do it unfacilitated, I think there's problems necessarily because you don't know what other people are going to say, right? But I would say like, well, do you think that I ever think that? And they'd be like, well, yeah, I think you also think I don't like you or whatever. And I'm like, no, that's not true at all. Like, I'll just tell them, I'm sorry that you think that way and that's how you feel, but that's not what I think at all, actually. And if you are confident in this, facilitate and have them like ask people, how they feel about them. And if you expect the response will be positive, that can be helpful. You don't want to over reinforce it because then you get them soliciting attention of just like other people exist to make me feel good. So it has to be limited. But sometimes it's just like rule governed behavior that has been inappropriately established. So you just need to establish a more powerful rule to replace the rule that is people don't like me and they don't want to be friends with me, if that makes sense. And for a teenager, yeah, do ACT. It's really good. The Peers curriculum has some fun stuff in there that you can use. So hopefully that's helpful. That's some stuff that I've done. And ACT is incredible for those kinds of things. All right. Hopefully that's helpful. If you had any other stuff I didn't get into, let me know. keep opening things in the wrong window. But yeah, teenagers are very narcissistic. So if she's a teenager, go back to the beginning of the video once this is over and look at everything I said for the first person I was talking about that was actually much young. No, it was also a teenager. Because they are narcissistic. It's developmentally appropriate. So the treatment for that is very similar to how I would treat people that actually have narcissistic personality disorder. Except, like I said earlier, they're not going to grow out of it because they're adults already, right? All right, now we have Lucas. I'm currently working with adults with IDD in a campus-based residential setting. I worked at a place like that in upstate New York. Maybe it's the same place. Wouldn't that be fun? Okay, mainly I work with individuals as they transition to human services. I love what I do, but I've always been interested in the school setting and being more involved in the transition process prior to aging out of the school system. Ideas on gaining competencies while working full-time in another setting. So one of the things I would say off the bat is children are not like wildly different to work with from adults. I don't think there's a lot of specific competencies you have to train unless they're specific to, like if they have Prader-Willi or like a very specific dangerous diagnosis, pica, stuff like that, then I would get those competencies. But even like pica in adults and pica in little kids isn't wildly different. So I think you're probably in much better shape than you're thinking. And I'm assuming you're not going to be working there totally alone. So the things that are different, there should be other clinicians there who might not also be behavior analysts, but that's okay. There'll be other social workers, psychologists, whatever they can bounce ideas off of to get an idea of like what's age appropriate. The one big difference, I spent most of my career in adult services, but I have worked in children's services. Maybe you're also at Upstate Cerebral Palsy, UCP, in Utica. That would be really funny. I used to live in Rome, New York. Nobody is from there. It's like in the mountains. It's beautiful. But really great team, and it would be wild if that was the same place. But the big difference is that if you are working with adults, there's a lot of like sex, drugs, no rock and roll, but it's fun to say all three, that are involved in adult services. So the stuff you treat and the kind of stuff you talk about and allow, like, I don't know how to, the easiest way for me to say this is working with kids is much, much, much easier because there's no one is their own guardian. If you need to put a restriction in place, it's much easier to restrict a thing. If a kid is a fragile diabetic, you can just lock up any sugar or any junk foods like that. With adults, that is not possible to do. If they bought it with their own money, even if they're going to go into a diabetic coma, you can't really take their own food away from them because it belongs to them and they are adults, right? So in most ways, everything is easier with kids services and schools, and you get more time off because there's just like a lot of breaks built into the academic year. All that said, I actually prefer working with adults and teenagers. I love teenagers. But I don't think you have anything to worry about. If you have specific questions about adult services, I did that and was a clinical director in adult services for like 10 years. So just like DM me or reply to your own post and tag me, and I'll answer what other questions you have. All right, time for a sip and another question. Let's see, what's this? Can I do the same wrong thing 5 times in a row? Because I've done it 3 times now. Let's see, maybe. I'm thinking I can. Okay, this is Jess Stevens. Oh, before I forget, and you guys should all know this because you can't post anything that has sufficient detail to be identifying. I am a board certified behavior analyst, doctoral, meaning I have to comply with the BACB Code of Ethics and Professional Conduct. I can't answer anything that has sufficient detail for it to be identifiable, and I also cannot give treatment advice, which is not what I'm doing. I'm saying what I would do, what other cases I've seen, some like things that you can try, but I'm not saying this is treatment for this person because I have not seen any of these people. I feel like that goes without saying, but everything is litigious and whatnot, so that's the disclaimer. If I mention something you posted, it's still your client who I do not know. I'm just talking about similar things that I've seen and maybe some stuff to look into, but it is not, you can't say like Dr. Shea said I should do this because I'm not providing you with treatment advice. So I just want to make that incredibly ultra super clear. All right, Jess. I'm looking for any and all resources for school refusal and academic disengagement. This is a preliminary research dive into the topic. I am currently a bcba working as dean of students, broadening my scope. Okay. I don't. So academic disengagement, like, this is going to sound so boring for me to keep saying this, but it's basically I would just do an assessment, do ABA, right? Like, they're not going to be disengaged in everything. If they are, then school itself has become a CMOR, or a aversive stimulus, which you don't want. So if it's school as a whole, you have to make school a conditioned reinforcer and pair it with other conditioned reinforcers. If they're disengaged in one type of task or one class, you have to figure out what the problem is with that class. Some more global problems I could think of at the top of my head is just like, if you have a cell phone, that's going to be a lot more like engaging, interesting, something that's going to like lure you into doing it than doing like math problems. So I think the ability to engage in something that's like TikTok or more captivating or alive, whatever, something like this is really hard for academic engagement. So I don't know what we're supposed to do about the phones. That's just really, really hard. The other thing is the last, like 2020 to at least 2022, there were a lot of years of learning that were lost, that you can't make up great. Like, they've done assessments, and most of the kids in public school who did remote school for a few years are behind grade level. Like, they're not doing super well. So that would be why like new classes coming in might seem more disengaged than previous ones, because they had kind of a different learning history with school that's really significant than peers. I'm noticing that in like freshman classes that are kind of filtering in this year to college. Um, that the people that had like the bulk of like their high school and stuff, or like certain formative years with distance education for primary school, kind of missed a lot of the stuff that other kids would just get routinely, and I feel really badly for them. Um, so someone wrote about academic disfluency. While the learner's not fluent at the task, it's hard for them to do it. Yeah, that doesn't need a special word. We can call it academic disfluency, but like, that's any behavior. If you're not good at it, it's hard to do. If it's hard to do, it's higher response effort, so you don't want to do it. So you have to lower response effort and teach the skill that you want them to do so that it's easier and they become more fluent. So that's what I would say for that. There's a lot of things you can do. There's school assessment scales. This is another one. I think it's like, I don't know. Like, I asked hypothesized function, someone else asked root cause, which is hypothesized function, but it's a lot of like standardized assessments, and again, things that we don't do as behavior analysts because it weakens the power of our science. So I wouldn't do any assessments specific to academic disengagement. I would figure out what's disengaging and recondition those events and kind of like modify the environment, because I think that's more likely to have good results than anything else. That's not behavior analytic, which is why I'm a behavior analyst and not a mental health counselor. Although I could have been. I actually just never bothered to get my license. Okay. Last one, Felicia. Does anyone have any suggestions for teaching an 8-year-old the difference between fantasy versus reality in everyday situations? That is tough. I picked that one because it's tough. I do not have great answers for that specific one, but I have been in the position of trying to teach someone with paranoid schizophrenia how to discriminate between things that are real and things that are delusions or hallucinations. A delusion being a belief, a hallucination being a thing you see, taste, hear, whatever with your senses. So there were a couple of ways that I did that. And this sounds kind of similar of how do you know fantasy versus reality, right? So one thing is just like you check in with someone else you trust. So for an 8-year-old, it'd be check in with a grown-up, like the teacher or whatever like adult is around that can be trusted to give relatively sane information, right? And have them ask like, oh, do you think this is true, right? And it doesn't sound that weird coming from a kid, but just having someone they can bounce the idea off of is really helpful. If they're thinking, like, it depends on why they're having trouble distinguishing fantasy versus reality. A lot of the kind of play that 8-year-olds and stuff do could look like that, and it's developmentally normal and fine. I kind of am wondering why you asked, because it's not a thing I would worry a ton about for a kid that young. Um, 8, they should start really being able to tell between the two, and there might be more like psychiatric problems that they should have checked out. Um, but I would need more information about that. But the most similar was when I had an individual who was schizophrenic, and he would hallucinate people talking about him when they weren't actually talking about him, but their lips were moving. So he'd see their lips moving like across, like when he was out, let's say like at the mall. It's a totally different place, but that's fine. So he'd see their lips moving, talking to each other. He heard them talking about him. They were not talking about him. They had no idea who he was or that he even existed, but he thought they were plotting to do him serious harm. So I would have him check with his staff if they were with him, of like, can you hear them talking? Do you think they're talking about me? If he didn't believe his staff, I would have him record the people that he thought were talking about him and then watch it back on his phone. And if he couldn't hear them talking on the phone, then he knew he wasn't able to actually hear them talking, and whatever words he was hearing were things that weren't real. Or if he was having like a visual hallucination, phones are great for this. You take a picture, and if when you take the picture, the thing isn't in the picture, then it's not really there. So there's like different ways I've done reality checking to help clients that had mainly schizophrenia for hallucinations and stuff like that. It doesn't work very well with delusions, but it works well for hallucinations, just to check in with somebody. So that's what I've got for you today. I'm really excited about this thing that I'm working on with my amazing, wonderful co-person. I don't have a title, but she's a professor with me. She is more on the mental health counseling side. She's not a behavior analyst, but I think for stuff like burnout and compassion fatigue and support, it's really nice to have someone that doesn't have to be within our scope, that can do those like feel good things that we all need. But that will be in about 2 or 3 weeks. On the 24th is when we're planning to do it, so stay tuned. All of the stuff I talked about is on my site, drshaybA.com, or you can find it on the link to, like, the Facebook group bcba resources I made. I'm the admin, so the page is my page. So if you click by Learn ABA with Dr. Shay, that's me, and you can find anything I talked about. Make sure you check out our partner, First Work. It's a great app. It helps you do discrete trials without laminating until you like have your fingers bleeding and want to cry and make little Velcro thingies. And I think that's all I have today. I'll see you guys in about a month because I've gotten busy. I couldn't keep this up once a week, but I will keep it up once a month. And have a wonderful night. Goodbye, everyone.